Hello, everybody. This is Brock McKeown. The name of the telemedicine company that I'm doing is called Mobile Recuperation, and Mobile Recuperation is a online physical therapy telehealth program. And physical therapy a can benefit greatly from telemedicine. After an injury or surgery, it is common for a physician to determine the need for physical therapy, and they'll write a referral and send the patient to a physical therapist. With mobile recuperation, the patient will be able to meet with a therapist over the computer or over the phone. And so mobile recuperation, it provides our community with the best patient care and has an obligation to use innovative solutions to fulfill our commitment. And so over half of all US health systems use some type of telemedicine technology. And in 2003, an estimated 350,000 patients utilized telemedicine services, and this is expected to increase to 7 million patients by 2018. And so this will allow mobile recuperation initiative to focus on helping to meet the community's need for an increased rehabilitation access. And so after the patient receives surgery, they must start the major recovery process in which they can be physically fit or be able to function their body. And if a patient decides to use mobile recuperation for their home, it's necessary for a physical therapist to first make a home visit for an evaluation. And they'll be able to see what must be done to help the patient. And they'll see what major tools and equipment the patient will need in order to be fully assisted in the best possible way. And they'll be able to see how major the injury is, and the therapist will also be able to install special cameras throughout the room, and they'll only be able to access these cameras when it is time for an appointment. And once the therapist sees what's needed, they'll deliver the equipment to the home of the patient, and the therapist will continue to visit the home of the patient and show them how to properly use the equipment, and until the patient feels comfortable enough to use the equipment on their own. And once goals are set, then the therapist will write out a specific plan with short-term and long-term activities. And it could take anywhere between 1 month to 6 months long, depending on the injury. And every week, the therapist will track their progress on whether they're improving their mobility or needs improvement, and then they will be able to update their goals. As far as the next step, the next slide is going over goals and objectives. And as far as the first goal, it is to implement realistic goals as a company, and developing a telehealth program based on clear goals and objectives allows for the highest level of success in meeting the organization and patients' needs. It's important to document where we are now and where we want to be in the next 3, 6, or 9 months. It's critical to the success of the patient's telehealth program to communicate the goals of our program to the entire staff. And at Mobile Recuperation, we must make sure that we outline how each staff member will be asked to contribute towards the goals and how they will be measured against them. And we must communicate any new expectations as well as changes in responsibilities and processes. The next goal is that people are uncertain how to embrace new technology, and if implemented correctly, physical therapists will find that telerehab can maximize the power of innovation for virtual care, and this will allow them to give patients the care they need and when they need it, while also allowing clinicians insight to what the patient is doing away from the clinic. The next goal is that physical therapists are taught to focus on the patient's individual goals, and they'll ask the patient what their goals are and what they need to be able to do again. We must make sure that they do their exercises correctly, and if we can use remote monitoring and telerehab technology, we will be able to reach beyond clinic setting and into the patient's home. And this would empower the patient to do more at home when they are not in front of you, and also maximize their recovery time. Technology is an important tool in their healing process that is convenient. It gathers data and provides feedback in real time and allows the therapist access to review the ongoing success of rehabilitation. When we evaluate the home for the first time, we must make sure they have the proper technology to be able to receive treatment remotely. And the last goal is that we will reduce the cost of healthcare. And this is one of the most important reasons for funding and adopting telehealth technologies. Telemedicine has been known to reduce the cost of healthcare and increase efficiency through shared health professional staffing, reduced travel times, and also fewer or shorter hospital stays. And people are always worried about coverage and cost. And it is important that we focus on empowering the patient and setting goals for them. Our collective goal is to improve the lives of who we serve. And the next slide that we'll cover is the revenue plan. And so the deployment costs of a mobile telehealth infrastructure and the reimbursement of services provided over this network remain two major impediments to the rapid deployment for mobile recuperation. Most of the technology costs and the consultations that are carried out through telemedicine are not reimbursed. And out of fear that the telemedicine equipment will be fast outdated, medical organizations are reluctant to purchase such equipment. One of the key challenges impeding widespread deployment of telehealth services involves developing an appropriate price plan. But given the potentially high capital cost of deploying a national telehealth network, reasonable pricing can only be achieved if costs are covered by all stakeholders in society, including the government and corporations. Also, a comprehensive analysis of all the benefits of telehealth must be considered to justify participation by non-traditional health stakeholders in building such a network. For reimbursement, an organization that wants to deliver clinical services through telehealth is always concerned about reimbursement. There are 3 third-party reimbursement categories, which is Medicare, Medicaid, and commercial insurance. And there are additional costs, including equipment and technology requirements. For medical devices, the specific medical devices you need may vary depending on the specialties you plan to service with telerehab. And the good news is you don't need to have all the answers right away, because many equipment providers have scalable and modular telemedicine systems. And this means that you can purchase just what you need to get started and then add additional devices later on as your program expands in additional specialties. The costs of medical devices for basic primary care services can range from $5,000 to $10,000, and this would include devices such as examination camera and other therapy equipment. Next slide, we will go over the telerehab software. Um, Choosing the telemedicine software program was very difficult. There are so many different programs to choose from that would meet my needs for physical therapy. Ultimately, the software that I chose to use was Physio. Physio is a physical therapy telehealth software platform that extends traditional practice online, and patients are able to follow treatment protocols anywhere with an internet connection. The therapist can monitor multiple patients remotely to ensure that they are using proper form. Physical therapists' experience with Physio is very easy to use. A physical therapist can monitor patients while they perform the exercises assembled from them. Um, and physical therapists are providing real-time feedback and direction to ensure safety and form, and they're documenting each patient encounter post-treatment. Um, Physical therapists can send video messages directly to their patients, which will expand their um, clinic's reach and relationship with every patient. Um, Physio provides a host of industry-leading video treatment exercise to use as well, and physical therapists can also upload their own exercises. Um, the Physio dashboard also allows clients to log in securely to access prescribed treatment protocols. Patients have access to multiple treatments, and they can also view progress or initiate a video session with a therapist at any time. Um, Patients love how easy it is to get started, and the interfaces are easy to navigate and understand. And once a patient starts a treatment session, they can communicate in real time with their therapist through video and text as well. All patient to physical therapist interactions are recorded and accessible to the therapist on demand. Another great feature is that once the patient has completed the prescribed exercises, they can record a personal video journal that's automatically sent to their therapist for review and response. Um, by choosing Physio, um, it's important to have something that specializes in physical therapy. It's accredited by the APTC, which is the American Physical Therapy Association, and that's very important to have. Physio is also HIPAA compliant, and it also seems to be much more cost efficient. Um, as a startup, it will be proficient enough to start off with just providing physical therapy. Um, So the last slide that we'll talk about is the medical licensure, legal issues, policy, and technical guidelines. And so physical therapy providers delivering care using technology must be authorized by law to provide physical therapy services in the state or jurisdiction in which the client is physically located during the therapy interaction. This originating site is the location where physical therapy care occurs. The client's site may change if the client's physical location changes between initial and subsequent treatments, and the provider must also be licensed in the jurisdiction where the client is located and must adhere to the laws defining scope of practice in that jurisdiction. Um, the provider should not be required to be physically located in that same jurisdiction, and the physical therapy provider should ensure compliance with regulatory requirements as valid. As far as legal issues, privacy and security of clients' records um, and exchange of information is vital for physical therapy encounters or any healthcare practice for the most part. It's important that proper steps are taken to ensure compliance with all relevant laws, regulations, and codes for confidentiality and integrity of identifiable client health information. Providers must comply with federal and state legal standards of medical um, and health information privacy, and this includes HIPAA, high-tech, and the Affordable Care Act, um, state privacy, confidentiality, security, and medical retention rules. The physical security of telehealth equipment and electronic security of data storage, retrieval, and transmission should be maintained. Providers and their staff should be educated in risk management strategies. This includes data and identity theft and deleting stored health information on technology devices. The next legal issue is emergency and client safety measures. This would be when providing physical therapy services, it's important to have procedures in place to face technical, medical, or clinical emergencies. Emergency procedures need to consider local emergency plans, as medical emergencies will most often be handled through typical chain of emergency procedures, such as notifying the client's emergency contact, notifying a local physician, or calling local first responders. Alternative methods of communication between both parties should be established before providing telehealth services in case of technical complications. It's our responsibility to inform the client of these procedures, and it's also the responsibility of the provider to have all needed information to activate emergency medical services to the client and their physical location if needed at time of the services that are being provided. During the provision of services, if the provider feels the client might be experiencing any medical or clinical complications or emergencies, will terminate services and the client will be referred to an appropriate level of service. And then the next one that we'll cover is informed consent. And it's important that the therapist must follow state requirements and professional best practices for requiring informed consent for in-person encounters. Clients should be made aware of any limitations that telehealth services present as compared to in-person encounter for that client situation. This includes the inability to perform a hands-on examination, assessment, and treatment. And given the unique nature of the provision of services through telehealth, there are some special considerations, including consent to being photographed, recorded, or videotaped, and consent to the storage of the encounter data if applicable. Disclosure should be made as to how long data will be stored. The next is consent procedures should include a harmless clause for medical or other information lost because of technology failures, and clients should be informed of the possibility of the technologies used to provide our services. The last one, or the next last, is the policy. And so as far as standards of care, physical therapists' responsibility to ensure the standards of care required both professionally and legally per the Practice Act is met. It's mandatory that physical therapist determines which clients and therapeutic interventions are appropriate for the utilization of technology as a component, and physical therapy interactions made using technology will be held to the same standards of care of those in traditional settings. And the documentation of the session should be held at minimum to the standards of an in-person encounter, and any aspects of the care unique to the telehealth encounter, such as the specific technology used, should be noted as well. And the last topic is technical guidelines. And so physical therapy providers need to have the level of understanding of the technology that ensures safe, effective delivery of care. Providers should be fully aware of the capabilities and limitations of the technology and that they intend to use, and that the equipment is sufficient to support the telehealth encounter. This ends my session. I hope you enjoy it, and thank you for listening. You have a great day.